Good afternoon, everyone. We're going to we'll be starting shortly. Thank you.
That's your mark. That's your mark. Stay. Okay, we are right on time. Good afternoon and welcome, everybody. My name is Penny Sweet, and I am honored to be the mayor of this beautiful city of Kirkland. Before diving in, I'm going to quickly introduce all of the guests that are standing with us. Obviously, Governor Jay Inslee, King County Executive Dow Constantine, King County Council members Rod Dembowski, Claudia Balducci, and Sarah Perry. Our North King County partner cities, Mayor Mason Thompson of, I'm not going to point. Somebody raise a hand. Mayor Mason Thompson of Bothell, Mayor Nigel Herbig of Kenmore, Mayor Jeff Johnson of Lake Forest Park, and Mayor Keith Scully of Shoreline. Morgan Matthews from Connections Health Solutions is here. Dr. Jeff Tomlin from Evergreen Health. Anna Nepomuceno from NAMI, Washington. Bothell Fire Acting Chief Jerry Hughes, Lake Forest Park Police Chief Mike Herndon, and our mental health professional responders, Brooke Butner and Renee Cox. We will also have a brief pre-recorded video by Senator Moncadingra from the 45th District. I also want to welcome the council members from Kirkland and our partner cities that are here in attendance, and there's a bunch of us. It's pretty cool. Finally, I want to welcome Tasnim, I never get your name right, Tasnim, Rahmani, yeah, in the audience today, who is a representative of our Ismaili community, whose place of worship neighbors the new Crisis Response Center. Thank you all for being here today. We all know we have a behavioral health crisis in our communities. These leaders and others have been taking action to solve this crisis. As today is International Women's Day, I find myself reflecting both on the rallying cry of the suffragists, which was deeds, not words, as well as a quote by author Jane Austen. It isn't what we say or do, or it isn't what we say or think that defines us, but what we do. Today, we share exciting progress by rolling out a new model to better help community members struggling with behavioral health issues. Community members in crisis need three critical things: someone to call, someone to respond, and a place to go. First, someone to call. We look forward to the continued rollout of the new 988 crisis hotline and are grateful for the work King County Crisis Connections has been doing to provide trained mental health counselors to anyone who calls or even texts 988. Thank you. Second, someone to respond. Not all cities can be, or not all crises can be addressed solely by phone. For years, the cities of Bothell, Kenmore, Kirkland, Lake Forest Park, and Shoreline have worked together to provide mobile crisis response alongside our police officers through our Radar Navigator program. This program has been a success in part due to mid-grant support sponsored by Senator Dingra, Executive Constantine, County Council members Dembowski, Balducci, and Perry. Thank you. This past fall, our five-city coalition joined forces to evolve this model into a new independent regional crisis response agency, AKA RACER, supported with funding from each city. This new agency merges the successful Radar program with Kirkland's Community Response Program to provide mobile crisis responders within a five-city region. I'm grateful for this collaborative effort that we hope can be used as a model for other communities locally and across the country. And the last piece of a complete behavioral health system, and the big news for today, is ensuring that there is some place to go. Thanks to the introduction made by King County last summer, our five-city coalition met Connections Health Solutions, a preeminent crisis care provider based in Phoenix, Arizona. Together, we are proud to announce that Connections Health has secured a location for comprehensive, no wrong door crisis stabilization clinic in Kirkland that will serve North King County and beyond. This new facility the first clinic of its kind in King County, will fill a needed gap in our continuum of care for people experiencing behavioral crisis. It is expected to start serving patients in 2024. Reaching this milestone provides a vivid example of governments working together to meet the needs of their communities. In addition to the doggedness of our five-city coalition, it has taken political and financial support from Governor Inslee, Senator Dingra, Representative Davis, and others at the state level, as well as Executive Constantine, County Council members Dembowski, Balducci, and Perry at the county level to turn this vision into a reality. The leaders you see before you, as well as many others, have pushed forward a vision of community-based behavioral health care and committed millions of capital budget dollars to support this facility and the vision this facility represents. To speak more about this vision and the support for this model of crisis care, I am pleased and honored to introduce Governor Jay Inslee.
Thank you. Thank you. First, I want to note the incredible demonstration of cooperation and teamwork in this challenge of these mayors and County Executive Dow Constantine. It is tremendous, it is necessary, and they are showing it is productive. Rather than pointing fingers at each other to the next city over and say, why don't you fix this problem, or why doesn't the county fix this problem, they are joining hands, working together, and I think we owe them a round of applause for their leadership on this. Look, we have a mental health care crisis in the state of Washington, and that's why I'm delighted to see a crisis intervention center right here in Kirkland. It is time that we stop thinking of our jails as the mental health centers for the state of Washington and start building these crisis intervention centers. It's time for officers, when they're doing their hard job, and they do have a hard job, instead of transporting somebody to the jail, takes them to a crisis intervention center where they can be stabilized and determine where the next step that they need to move forward. This is good for the individuals, this is good for the community from a public safety standpoint, and it's good for the health of everyone in the state of Washington. So I got to tell you, this is the model of what we need to do. We are doing it in other places as well. I was really excited to be in Bellingham to see one of the first in the state of Washington, and I know that this is going to succeed. And the scale of this is absolutely tremendous. I was just talking to the leader of the organization going to run this, who told me that they could serve 14,000 people in this one facility. Think about this, 14,000 people who are otherwise out there in anxiety and schizophrenia and paranoia and every other thing that we know bedevils our citizens. 14,000 people now have a shot to get well as the first door of getting well. So I just think it is a tremendous achievement. I want to thank the people of the state of Washington. They've chipped in $10 million of capital dollars and an additional $10 million to our supplemental budget. We believe in doing this. You got to continue building this across the state of Washington. I want to note something just for a moment, though. In our mental health system, in our chemical addiction system, there is something that these folks need if they're going to deal with their mental health problems, and that is housing. We cannot solve this problem just with psychologists. We cannot solve this problem just with chemical addiction specialists, because those folks can't do their job while a person's under a blue tarp somewhere out on the streets. We know now, I say this because, as you know, I've suggested the legislators this year on housing, they need to go big so people can go home. And I've heard some people say, no, it's just a drug problem. It's just a mental health problem. Well, it's those two things and housing. Because if we're going to solve the mental health problem, when these people walk out of the crisis intervention center, they're going to need a roof over their head so they can continue to get the therapy they need to really get well and get back to their schools and their businesses and their families. So I'm looking forward to more success here. And again, thanks for all the leaders who've done such a great job here. Let's keep this ball rolling. Thanks.
And now here is our executive, Dow Constantine.
Thanks so much, Mayor Sweet, and thanks to everyone for being here today. This is an exciting day. We've really been looking forward to. We're looking forward to many more like this in the months and years ahead. And thank you, Governor Inslee, for your support of this work. I'm thrilled to be here in Kirkland. Kirkland has stepped forward along with our other northern cities in King County, Kenmore and Bothell, Lake Forest Park and Shoreline. And they're really carving a path forward toward more compassionate and effective behavioral health care. You know, behavioral health care, it's been mentioned, is woefully lacking in this one of the most prosperous and progressive places in the country, in King County, in the state of Washington, and yes, also across the entire United States. We are very grateful that we were able to secure a $10 million state capital grant to build out this crisis center. And King County is contributing in our 2023-24 budget another $1.5 million to help make that happen. I'm excited to see this commitment and ingenuity and caring from our 5 northern cities. And they've established this regional crisis response approach and created a path forward for community-based crisis center. And I'm wanting to hold them up as an example for all the other leaders across our county. And I know I've talked to them. Many of them are very enthusiastic about getting moving on this. But it is going to be absolutely critical that we all pull together north and south, east and west to make sure that we are providing the care that has been lacking in our county. To turn the tide, we have to find innovative solutions to expand mental health supports and addiction supports. And last fall, with Mayor Sweet, with Councilmember Dembowski, and many other partners, we sounded the alarm on this crisis in King County. Working with our communities, elected leaders, first responders, law enforcement, I proposed the Crisis Care Centers levy. This would be one of those kinds of crisis care centers. And with unanimous approval from the county council, we have forwarded, and the Regional Policy Committee, we have forwarded to voters that levy, which, if approved, will invest $1.25 billion of local money in responding to the behavioral health crisis here in King County. So it creates 5 crisis care centers. Right now, there's no place you can go. Bring yourself, your family can bring you, a human services professional. There is no place you can go in a time of crisis. You can get your name on a list, And in a few weeks or maybe a few months, you might get a call offering you help. That is utterly unacceptable. One of those centers will be exclusively for youth, by the way. Then we will stop the loss of and begin rebuilding the supply of the long-term treatment beds that people need once they're done with the crisis center to begin to recover and put their lives back together. We've been losing those at an alarming rate. The facilities are old. The human service agencies can't keep up with the maintenance. They're having to close them. And we've been running around trying to keep the capacity. This funding will help us finally begin to rebuild. And lastly, investing in the workforce. This has been historically a low-paid, high-stress profession, and people, as they are in many workplaces, are leaving in droves. We need to support their compensation. We need to support apprenticeships and training and the support people need to come into this noble profession because it takes people to treat people. So this announcement today is a down payment on reversing the disinvestment that has happened over decades in critical behavioral health care. And I am grateful to the leaders of the City of Kirkland and all of our North cities. I'm grateful to Senator Dingra, in particular, who helped with this, to Governor Inslee for his support of this important project. And I just need to remind us all that that treatment works and that people recover. But you have to have access to that treatment. When you reach out for help, that help has to be there. Providing a place for all people in crisis to receive effective care makes that recovery possible. And with the partnership of our county council and voters countywide, we will take a big step forward in providing the kind of care, the level of care, and the level of caring that the people of this county deserve. I want to welcome one of those unanimous county council members now to share some more thoughts with you, Councilmember Rod Dembowski.
Thank you so much, Dow, and good afternoon, everybody. How are you? It's good news, right? My name is Rod Dembowski. I have the honor of representing District 1 on the King County Council, and District 1 includes the beautiful communities of Shoreline, Lake Forest Park, Kenmore, Bothell, and Kirkland. And we have a number of elected leaders here from those communities, and I'd just like you to take a moment, if you wouldn't, stand up and receive some appreciation for your leadership here. I have to tell you, I've had the privilege of working with these cities and their leaders, both elected and staff, for a decade now. Got some gray hair. That's coming in. And there are no better partners. There are no better partners anywhere in terms of stepping up to ensure that our region prospers and thrives and is a wonderful place to live than these cities. Now, they're relatively small, but they punch above their weight, Governor. And particularly when we work in partnership with cities and county, we are a powerful, transformative, action-oriented team, Mayor Sweet, that gets things done and gets good things done. And so it's no surprise to me that North King County cities, in partnership with King County, the state, and our nonprofit and private sector partner, Connections Health Solutions, are leading the way to fill a critical gap in behavioral health crisis care services. For too long, we've relied on our police officers, our jails, our firefighters, our courts to substitute for the comprehensive behavioral health care system that we need. And it's an unfair burden for our first responders. It's not effective, and it's very, very expensive. A day in the King County Jail, and we try and keep our costs down, right now, but a day in the King County Jail costs $257. If that person needs behavioral health care services, kick it up to $424 a day. And we've got a lot of folks with those mental health needs in our jail. Right now, frankly, we are breaking under the strain of inmates who are more sick than they are dangerous. When we arrest and jail and prosecute and jail again, the cycle continues and the problem doesn't get solved. And so that's why today's announcement is so important. Establishing this new behavioral health crisis care center in North King County represents a major accomplishment. It's It's a major accomplishment, and it builds on years of foundational work intended to stop this expensive cycle of failure. Just a little bit of history. In 2016, I was summoned up to Bothell by then Chief Carol Cummings, and I see our Deputy Chief is here, Johnson, and Chief Harris from Kirkland is here. Stand up and take a round of applause. You guys are amazing. Chief Cummings at the time, she's now retired, invited me up along with Shoreline Chief Ledford, who's back now at King County. And they brought some of their first frontline officers in, and we had a good talk. And I heard directly from them about their need and desire for help in responding to calls involving people with mental health and substance use disorder challenges. The police officers' tools at that time were too often limited to either take no action or arrest and jail the individual. It was one of the most powerful meetings I've ever had in this job. These police officers knew that there were better options, and they asked for help. They asked for help in standing up a new program called RADAR. RADAR stands for Response Awareness, De-escalation, and Referral. Who are you responding to? How can we de-escalate the situation? And then how do we refer that person to the right set of resources? It's what we call a co-responder model. RADAR would pair behavioral health professionals with an officer in the field to get people the crisis care they needed rather than either no help or that trip to expensive jail. Well, we went to work down at the county and we passed at the county council a special appropriation of over $700,000 of our mental illness and drug dependency money, and we worked in partnership with our cities to stand it up. Over the last few years, the county has contributed over $3 million to support the RADAR program. It has been independently analyzed, and it passes with flying colors. We're now growing that program into the Regional Crisis Response, or RACER program, and it has just given stellar results. But to achieve its full potential, as Mayor Sweet said, you've got to have a place to take people, right? You can respond and you can assess, but then that referral part is so important, and that's what this is so exciting. That's why this is so exciting. So we're going to have that place for North King County to refer folks to. And that's good for the person, as the governor mentioned. It's good for the person who's suffering. They get better. It's good for public safety. We can reduce the crime too often associated with those struggling at the edge when they get the care they need. And it's good for our pocketbooks. Jail's super expensive and it's not effective. So today, it's an exciting day. It's been years in the making. We wouldn't be here without the dedicated leadership of North King County cities, their elected leaders, and their professional staff. Let's just take a moment. If you work on the staff of one of our cities, raise your hand or stand up. You've done an amazing job. Yeah. And I want to give a special recognition to the RADAR Program Director, Brooke Butner. Brooke's right up there. Yeah. Her dedication, her vision, her tenacity has made this day possible. She has built this program up in partnership with everybody, and it's that work that's allowed this day to occur. So it's a privilege for me to be on this team. We have modeled the way. I hope, as the county executive said, we can expand this model countywide, governor, statewide. We're doing it the right way here. And to hear more about how we're going to do it, please join me in welcoming to the podium Morgan Matthews from Connections Health Solutions.
Good afternoon. I'm Morgan Matthews, the Vice President of Partnerships at Connections Health Solutions, and I'm honored to represent Connections as we join the community here in King County, and more specifically in North King County, in bringing a dedicated behavioral health crisis response center to the area. I would like to congratulate and commend the communities of Bothell, Kenmore, Kirkland, Forest Park and Shoreline for a truly heroic effort, banding together to address and solve an unmet need in their communities. The work being led across these 5 cities will save lives and get people the care they need right when they need it. I would also like to take a moment to thank both King County and the Department of Commerce for generously supporting the Crisis Response Center. King County has generously allocated $10 million from the state legislature and $1.5 million from local funds. And the Department of Commerce has awarded Connections $10.02 million in grant funding to help bring the Crisis Response Center to life. I'm excited to share information about what Connections does and what you can expect from us when we open the Crisis Response Center. But first, a little bit about us. Connections Health Solutions is the leading innovator in behavioral health crisis care. For more than 30 years, our person-centered approach has ensured people in crisis get the care they need quickly. We operate two of the nation's largest and most studied behavioral health crisis response centers. Industry experts and leaders, including the Substance Abuse and Mental Health Services Administration and the National Council for Mental Wellbeing, have adopted our model as a national best practice. As the speakers before me have shared, addressing the unmet need in behavioral health crisis care has been a priority for the North King County Coalition city leadership. Notably, King County has 0 dedicated crisis stabilization facilities and 0 dedicated crisis stabilization beds. This means every day, individuals seek crisis care at emergency rooms or end up in local jails out of necessity, putting an immense strain on beds and resources needed both for physical health emergencies or for correctional needs. And many times, individuals are discharged early or sent home without receiving complete treatment or a behavioral health follow-up plan. Again, this is out of necessity. That's why we're working with these 5 cities and the county to establish a dedicated crisis response center that can relieve the pressure placed on these community resources while allowing individuals access to high-quality behavioral health crisis care in a dedicated, safe, and treatment-oriented environment. The location of the Crisis Response Center will be in Kirkland and is accessible to North and Northeast King County cities. The center is in close proximity to Interstate 405, State Route 522, and local hospitals, so that transportation is not a hindrance to care, whether individuals walk in, are transferred from regional emergency rooms, or arrive in the care of first responders. Thank you. Thank you. Everyone experiences behavioral health crises differently. What may be a crisis for one person may not be a crisis for another. Regardless, we at Connections will welcome and be able to care for all people experiencing all types of mental health or substance abuse crises. Individuals seeking our care will receive respectful, discreet, and personalized treatment that is proven to promote the best health outcomes. Also, Connections is our name for a reason. We not only stabilize an individual's crisis, but we connect them to community resources such as housing, transportation, and other social services designed to keep them on the path to recovery. Dedicated behavioral health crisis care like that provided by Connections is proven to support reduced rates of hospitalization and psychiatric patient boarding in emergency departments. Additionally, communities with access to these best practice crisis services see a reduction in law enforcement involvement in behavioral health crises and fewer arrests, as individuals in crisis care receive care in more appropriate settings. So in short, better crisis care delivers a positive impact both to the individuals and to their communities. We're pleased to be a part of this community and to join in King County's focus on providing dedicated behavioral health crisis care to all those who need it. Thank you. And with that, it's my privilege to turn it over to Anna Nepomuceno, Director of Public Policy for NAMI Washington, a champion for bettering the quality of life for those affected by mental illness, their families, and our entire community.
My name is Anna Nepomuceno, NAMI Washington's Public Policy Director. Honored to be here today representing the NAMI Washington Alliance, specifically our NAMI Eastside affiliate, which covers municipalities east of Lake Washington. I want to thank Governor Inslee and all the elected officials here for your continued commitment towards a behavioral health care system that can meet the needs of every Washingtonian. The Kirkland Crisis Center and other centers like it can give individuals in mental health crisis somewhere to go to receive immediate trauma-informed care. When communities are provided with these centers, it means that people in crisis will no longer have to sit for days in emergency rooms or jails, or go for months without treatment. It means that individuals can receive access to longer-term treatment close to their families and support systems. It means that when people call 988, they can expect their behavioral health issue to be met with a behavioral health response. NAMI Washington and NAMI Eastside are proud to support the Kirkland Crisis Center and help promote the value and need for the community-based facility. And although she can't be here today in person, I am happy to introduce a brief video by Senator Manka Dhingra, who has been an amazing leader and advocate for mental health.
Thank you all so much for being here. I am so sorry that I couldn't join you all, but I cannot tell you how excited I am that we have these wonderful cities joining the program. When this program first started, it was simply a hope that we can build an entire crisis response system for the state of Washington. And we have made so much progress in that regard. I am excited that with this partnership, we can envision the plan we have for 988, making sure that individuals who are struggling with mental illness have a place to go, a place that is no wrong door, that the person opens the door and says, welcome, takes them in, stabilizes them, and ensures that there's follow-up care, that they're taken care of, and on their journey to recovery. I really hope that this is going to be a model for the rest of the state, so we can truly help all the individuals in Washington when they're struggling with a mental health crisis. We know it's not illegal to have a mental health crisis, and it's about time that we have a system in place that treats a mental health crisis like the medical emergency it is, and not a criminal justice issue. So thank you all so much for all your work, and I am very excited to join you all through video. Thank you.
Okay, I just want to thank everybody for being here today. And if folks could just step up, I'd like to get one picture to sort of commemorate this day. Okay.
They're late to their next thing.
Okay, that's fine. All right, well, the important cities are here anyway. Let's get... So let's have representatives of the cities electeds up front, and let's get a picture there, please. And this will wrap up this portion of the event, and guests will be available individually for follow-up. We need to wrap. We've got to press pause, so we need to get everyone.
Slide in. Absolutely. We'll get close.
Don't know who to look at. This is the problem.
Oh, you need to scoot in? Oh,
They're trying. Oh, hi. They're trying. Okay.
Here we go. 3, 2, 1. There you go.
Take off.